Well, it's not just the vaccine preventable diseases in Venezuela, but I think the first outbreak I started paying attention to a lot was malaria. So we're talking about vector-borne diseases are also on the rise. The number of malaria cases has risen dramatically in recent years. Doctor, what can you tell us about the malaria situation in Venezuela?
So, yes, it's not only the reemergence of vaccine preventable diseases, it's also vector-borne diseases like malaria, as you point out. And then we can later talk about Chagas disease and leishmaniasis, which you also have to keep an eye on. Mm-hmm. And I think, Robert, the case of malaria is probably the saddest story of Venezuela's sanitary and healthcare system collapse. Venezuela was once recognized as the world pioneer in malaria eradication, thanks to the efforts of Venezuelan physician, John Hopkins graduate, Dr. Arnoldo Gabaldon, who successfully carried out a malaria control campaign in Venezuela, which was implemented with the interruption of malaria transmission by systematic and integrative infection and vector control. And, actually in 1971, the malaria-free regions in Venezuela had increased close to 80%. So this is a sad story for a country that was a pioneer in malaria eradication policies. Today, however, malaria epidemic in Venezuela, as you mentioned, is now approaching 500,000 cases per year and continues to increase at rates exceeding those previously reported anywhere in the world. What is more is that endemic malaria transmission is now beginning to propagate across the whole country, including urban and peri-urban foci. And this along combined with an increase in the hotspot, which actually persist and continue to disseminate the cases in the Guayana region. And this is striking. This is really striking, given that Latin America had made a substantial advance towards elimination with a regional reduction of disease up to 62% throughout 2015. However, there was a considerable increase of up to 875,000 cases that was observed in 2016, and with Venezuela contributing close to 35% of these cases. So malaria is not only becoming a problem to Venezuela, it is becoming a problem for our neighbors. This poses a huge risk to our neighbors. Data that we have is that throughout 2016, 2018, there was a total of 258,000 or so malaria cases reported in Colombia. And from a total of 3,395 cases imported from other countries, 3,124 cases were imported primarily from Venezuela. That means that Venezuela actually contributed with 92% of the imported malaria cases to Colombia. And it's not only Colombia, it's other South American countries that have also felt the impact of mass migration from Venezuela and the spread of important malaria throughout the region. This is important because this is basically the case of current cross-border outbreaks that are taking place at the Ecuadorian and Peruvian border. Similar to our observations, most of the cases, up to 96%, recorded to date in the Pacific Ocean coastal region, have actually followed the influx of infected Venezuelan migrants. For example, countries like Ecuador, with an effective nationwide elimination program in place, the arrival of malaria-infected refugees is posing a very strong risk of malaria reemergence, with imported cases exhibiting a capacity to trigger, again, autochthonous malaria transmissions in disease-free areas. And this has been reported previously. As for other countries, other malaria-endemic countries, Venezuela, other malaria-endemic countries such as Brazil and Colombia, the burden of important cases from Venezuela may also influence a shift in malaria endemicity. So we are basically putting our neighbors at risk.
Now, like with measles, did malaria also kind of get its start in the mining areas?
Yes, so that was basically the start, and it coincided with the illegal mining activity, which basically increased with the massive migrations, with the informal job and people migrating down south. So basically, most of the malaria cases can be tackled down to the illegal mining activity in southern state of Bolívar.
Okay.
And you know what, Robert?
Yes.
Let me tell you, since I brought Dr. Gabaldon when we started talking about malaria, actually, you know, malaria-free regions in Venezuela did not see malaria cases since the 70s. And Dr. Gabaldon actually said, you know, he wrote once that malaria eradication could be attained in the near future, but it was going to be impossible to contain in two scenarios: out-of-doors transmission, one scenario, and those areas that were inhabited by nomadic people, like the Indian tribes that I've been mentioning throughout our conversation in the Amazon and Bolívar state. And you can imagine the scenario that, you know, if you have, for example, malaria-related deaths, and you have to sign a death certificate, you have to sign that with the National Guard standing right next to you. And it's absolutely prohibited to list malaria as a cause of death in a death certificate. So you can imagine if you have any attempt of signing a death certificate with yellow fever, that will probably take you right straight to jail.